Hello and welcome to Jasper's educational series, where today we're going to talk about the value of psychosocial care. And I have the privilege of being joined by Melissa Antonchik from the Blood Cancer Foundation of Michigan. Before we get started, I just want to review what our agenda will be for today. I'm going to take a moment to tell you about Jasper and also our cancer organization partners. The Blood Cancer Foundation of Michigan is one of those. And then we'll talk about psychosocial support, what it is, what the benefits are for patients and their families. So Jasper is the free digital oncology platform for patients along the cancer trajectory, as well as for their caregivers and other loved ones. Jasper Health follows a whole person approach to meet each individual where they are on their journey. The Jasper app acts as a smart planner, a tracking tool, and a resource hub all in one place. And our Jasper care coaches, myself included, act as an extension of your traditional care. Our care coaches are available to make custom recommendations in the areas of nutrition, emotional and spiritual wellness, financial toxicity, and survivorship, just to name a few. Jasper members are able to track their moods and symptoms, have access to educational videos based on the interests and side effects that they indicate, and receive help with appointments. All of our members experience the one-on-one support and guidance based on their individual needs. Jasper's goal is to improve the lives of all people living with and affected by cancer by providing purposeful and individualized support. It's important for Jasper to have partnerships with other organizations that share this mission. And that's why to date, Jasper has over 60 nonprofit partners nationwide with whom we've linked arms to become successful in providing the most meaningful support to our members. So, September is Blood Cancer Awareness Month, and in honor of that, I'm excited to be joined today by our guest, Melissa Antonchik, from the Blood Cancer Foundation of Michigan, to discuss the importance of psychosocial care for cancer patients and their families, and to share how her organization provides support. So, Melissa, I'm going to turn it over to you. If you could introduce yourself and tell us a little bit about your organization.
Yeah, good morning. So my name is Melissa Antonchik, and I am the Director of Patient Support for the Blood Cancer Foundation of Michigan. We've been in existence for more than 70 years, and our mission is to ensure the emotional, social, and financial stability of Michigan blood cancer patients and their families. We understand that blood cancer does not just affect the patient, but affects the entire family, and our goal is to support the entire family unit.
Nice, very great. So can you tell me a little bit about where your services are available? Are they available throughout the whole state?
Yes, we are a statewide organization, so we're available to blood cancer patients and their families in all 83 counties in the state of Michigan. And we currently have 80 patients or 80 counties where we have active patients.
Wow, that's amazing. And do you have physical offices? And if so, where are those located?
We do. We have one office that's in Farmington Hills, Michigan, which is in Metro Detroit. We also have 2 remote staff members, one in Grand Rapids and one in Mount Pleasant. So we're located throughout the state.
And what is the prevalence of blood cancers in Michigan?
So 10% of all cancer diagnoses are blood cancers. And for that, that means 18 new patients each day in the state of Michigan are diagnosed with blood cancer.
Wow. It's amazing and great that you offer this support throughout the state. So as I said earlier, today we're going to talk about psychosocial support. And I just want to preference this part of our conversation by saying that this is often interchanged with emotional support. And emotional support is one piece of psychosocial support, but perhaps the most important piece. So psychosocial support is a holistic, whole person, individualized approach. and it addresses the physical, emotional, spiritual, and social well-being of individuals. It tends to bridge that gap between traditional medical treatment and overall health and wellness. This is why organizations like the Blood Cancer Foundation of Michigan are so important, as they address the unmet needs of patients. Psychosocial support offers guidance and resources in areas like nutrition, physical wellness, financial toxicity, insurance concerns, and emotional well-being, just to name a few. Melissa, is there anything else that you would add to this definition of psychosocial support?
I think psychosocial support is really a holistic approach. It's not one-dimensional. And I think that there's still sometimes a stigma associated with it for people feeling like in order to take advantage of psychosocial support, there needs to be something wrong with them. And that's not necessarily the case. It's just to help improve their overall well-being.
Right. Yes, it's a very great point to make. And how does the Blood Cancer Foundation bridge the gaps in traditional medical care for blood cancer patients?
So as you can see, we have 4 key pillars of support that we provide to blood cancer patients and their families, each of which is an aspect of that psychosocial support. So the first is that we do offer disease education and resources. We want to empower patients and families to learn about their diagnosis, to feel that they can ask those important questions, to be educated and knowledgeable about what's going on within their bodies. As you mentioned, Michelle, we do also have that emotional support because we're a statewide organization that's primarily done over the phone, and we're able to customize that care plan to each individual patient and family member. So if they've just been diagnosed and they're feeling overwhelmed and struggling, we can call them once a week to check in, see how they're doing, offer advice, resources, and support to them. As they get further along in their blood cancer journey, they may only need a call from us once every few months, or potentially even just once or twice a year, and we're able to offer that. We do also have the financial support because we know that when you're struggling to meet your basic needs, it's really difficult to focus on your emotional, social functioning and well-being. And then we do offer that social support as well. So we have various events and activities throughout the state to give patients and families the opportunity, first of all, to not have to worry about the high cost of going out and having these social activities, but also to connect with other patients and families who are going through a similar experience.
Nice. And do you have support groups for patients and their families?
We do. We actually offer a blood cancer support group. It's a monthly drop-in group. We partner with Cancer Support Community of Greater Ann Arbor, which I know is another one of your nonprofit partners. And this is for adults who have been diagnosed with any type of blood cancer, just an opportunity for them to connect and share what's going on in their lives and get that professional support as well as that peer support.
Yeah, that's wonderful. So why is it important to have services that are disease specific? In other words, specific to blood cancers?
So blood cancers, actually, it's a wide range of diagnoses. There are nearly 200 unique types and subtypes of blood cancers and disorders that we support at BCFM. But what's interesting about them is that often blood cancer patients may not look like the traditional idea of what a cancer patient would look like. They may not lose their hair. They may not lose a tremendous amount of weight. And by all intents and purposes, may look like they're very healthy from the outside. However, on the inside are still going through all of the experiences of having to deal with cancer treatment, the side effects, the ongoing effects of it. And what we find is that sometimes unfortunately, for individuals who have this lifelong diagnosis or who have constant relapses, unfortunately, sometimes that support tends to kind of dissipate a little bit over time. If this is something they don't necessarily look like they have cancer and it's been going on for several years, they may not have access to that ongoing support that they still need regardless of where they are in their blood cancer journey. Additionally, there are several types of blood cancers where they're in what we call a watch and wait phase, which
Mhm.
means that they've been told that they have cancer, but aren't in a position to actually be able to treat it yet, which is an incredibly difficult thing, to kind of come to terms with, is that you have cancer and you're kind of feeling helpless to do anything about it. That's something where we're able to kind of offer that unique perspective and support for individuals that a lot of other cancers don't experience.
Right, right. And I see also that that you serve both adults and children. So can you tell us a little bit about how you're supporting your patients and their caregivers and families?
We understand that, as I mentioned, when an individual is diagnosed, it does not just affect them, it does affect their entire family. So
Mm.
whether it's a pediatric patient and one or both parents need to stop working so they can ensure they're taking their child back and forth to treatment. We also know that it affects the siblings. And for adult patients, obviously their children are affected if their spouse or significant other needs to take time off of work. We also know that it's very difficult to process what's going on. So actually, I'm a blood cancer survivor. And for me, when I was going through treatment, I actually saw how difficult it was for my family because I knew what I was feeling. I knew what was going on within my own body, and everybody around me really kind of had to guess for that. And that was a big struggle for them. So we understand that there's so many ways blood cancer affects the entire family. We want to ensure that we're supporting everybody who's been affected by it.
Right. And that what a great approach. And thank you for sharing your personal experience. And I'm sure that informs so much of what you do in your work. Uh, I'm going to advance to the next slide here to talk about kind of the numbers and the scope of the services, the lives that you've touched.
Yeah, so as I mentioned, we've been in existence since 1952. We actually started out as Children's Leukemia Foundation of Michigan and transitioned into the Blood Cancer Foundation, just to more accurately represent the work that we've been doing for nearly 70 years already. Within that, we've supported more than 30,000 patients and family members over the last 71 years. This previous fiscal year, we provided more than 1,400 hours of case management services to our patients and families. We have an active caseload of 2,750 patients at this point. And as I mentioned, we do have a financial assistance program. One of the biggest aspects of that program is our travel reimbursement. And this last year, we were able to reimburse for nearly 400,000 miles for patients to get back and forth to their blood cancer treatment. One of the key aspects of our service that makes us unique is that patients are never discharged from our service. So regardless of whether they've just been diagnosed or they're 10 or 20 years out, if they can benefit from our support, we're going to offer that to them. We know that often many individuals, for example, with a multiple myeloma diagnosis, may be dealing with this for the rest of their lives.
Mhm.
Or there may be a concern of relapse from remission, or they just may be struggling with the long-term effects of their blood cancer diagnosis. We know that just because treatment has ended doesn't mean the issues that are affecting you have ended. And we want to be able to provide that lifelong support. We don't want there to be barriers to prevent them from getting the support that they need.
Right. Wow. So not only do you have such a wide scope in terms of the number of patients and families that your organization has touched, but you continue to support them, throughout their entire journey. And I think that's such an important component. So let's move on to talk about the importance of psychosocial support. And that psychosocial support really values the unique needs of each patient. Everyone's journey looks different. And Melissa, I think you have spoken to that already about that importance of that individualized approach. And everyone's needs are going to look slightly different. Psychosocial support is going to provide patients and their families with tools and resources to meet those individual needs, to provide coping skills and strategies, to improve overall quality of life. And as patients progress through the different phases of their cancer journey, their needs for support will change. And I think, Melissa, as you pointed out, working through the whole trajectory of one's cancer journey is really important. And for the types of support to be flexible to address the specific issues related to each stage. In your experience, why is psychosocial support important for blood cancer patients?
As you mentioned, everybody's experience is so unique. You can meet two individuals who are diagnosed with the same type of blood cancer at the same time and have completely different needs. Some people may be struggling really kind of with the effect that it takes on their work life. If work has always been really important to them, having that taken away from them can affect them really negatively, whereas other people may be affected socially by it or financially. The value of that psychosocial support is really giving them the opportunity to normalize their experience and help them cope with how they can get through this, how they can come out better, when they're done with treatment or throughout the course of their treatment. If this is something they're dealing with for the rest of their life, how do they adapt to this new normal that they have in their life? And that's what we can help them do with this psychosocial support.
Right, great. And that really brings us very nicely into the benefits of psychosocial support. And one of those benefits is really to develop a feeling of empowerment. And I think, Melissa, you really spoke to that in terms of normalizing the experience for individuals and their families. Some of the other benefits are symptom and side effect management, and improving health-related quality of life. Also, patients are better able to communicate with their family and friends and their healthcare team. And they have access to connecting with other people that are going through the same experiences if they so choose. And that reduces feelings of isolation. We'd like patients to know you're not alone. Psychosocial support could also improve feelings of self-efficacy, and as I spoke to before, empowerment. So, Melissa, one of the things that I'm curious about is how I know you offer one-on-one support and also support groups. And so what do you see as kind of the benefits of each type of support?
Well, it really depends on the personality of the individual who's receiving that support. If you tend to be a more private person, you may not feel comfortable sharing your life experiences in a large group of essentially strangers. So that in that instance, it may be more beneficial to get that one-on-one support. If you're comfortable, if you're looking for kind of that sense of community, you may benefit more from the support group. With the one-on-one support, the value is that you can really build off of each conversation with your unique needs. Whereas with the support group, you're kind of sharing your information and doing a little bit of comparing to what other people are going through. So you're getting that connection from others, but you're also kind of able to see the differences. The other value is that potentially for new people who are diagnosed, it's really nice to hear from individuals who are further along in their cancer journey. It really gives you that sense of hope that you can get there as well. And for individuals who are further along, being able to offer that level of support to those newer diagnosed individuals can be really meaningful for them as well. So there's really a strong sense of reciprocity with the give and the take in those groups. And there's a lot of value in both of those things. So, it really is a very personal decision for individuals.
Right, right. Yes, and what a great point about the value of the support group in the sense that it is reciprocal. That when you're participating in a support group, you're both receiving support and also have that opportunity to give support back. So what a great point to make about that. So to kind of wrap up here, how can patients access information from your organization?
So the best way to get connected with us is through our website, which is bcfmichigan.org. If they're local, they can also call us at 248-530-3000. And many patients actually get referred through their hospital social workers. So if you do have a social worker, you can definitely ask them and they can fill out the referral on your behalf.
Very nice. Great. So first and foremost, I want to thank you, Melissa, and the Blood Cancer Foundation of Michigan for all of the services that you provide to patients, and also for being here today to talk about the value of psychosocial care. I want to thank everyone who's watching this video for taking the time, and also to encourage you to visit hellojasper.com for more information about Jasper and our educational video series. And finally, wishing you wellness from our entire Jasper team. Have a great rest of your day.